Hi, folks. My name is Dr. Zori Paul, she, her pronouns. I'm a clinical assistant professor and a IWL 2024 Fall Faculty Fellow at Marquette University. In 2023, the former U.S. Surgeon General, Dr. Vivek Murthy, released a report called Our Epidemic of Loneliness and Isolation. In this report, he declared that there was a national problem with loneliness that was occurring even before the social isolation of the COVID-19 pandemic. This report defined loneliness as a subjective, distressing experience that results from perceived isolation or inadequate, meaningful connections, where inadequacy refers to the discrepancy or unmet need between an individual's preferred and actual experience. It's important to note that loneliness is different from solitude. Solitude is defined as a state of aloneness by choice that does not involve feeling lonely. So someone can be alone, but not feel lonely. Dr. Murthy further described loneliness as far more than just a bad feeling, and that it harms both individuals and social health, with loneliness being associated with greater risks of cardiovascular disease, dementia, stroke, depression, anxiety, and premature death. It's understandable that he's calling it a loneliness epidemic. Well, social connection, which includes interaction, relationships, roles, and sense of connection that individuals, communities, or society may experience, is important. However, many of the current literature looks at loneliness as an individualistic problem, something that the individual needs to figure out, and that if they don't, it's on them. However, we know that marginalized groups experience high rates of loneliness. Examples of these groups include racial ethnic marginalized groups, LGBTQ plus groups, individuals who come from low socioeconomic backgrounds, and also individuals who are immigrants, just to name a few. And when we use the example of a person working multiple jobs because the minimum wage does not meet the high cost of living, it's kind of hard to say that that person should just go out and meet new people and make new friends and not be lonely anymore. It becomes more evident that for that person, loneliness is more of a societal issue, of a systemic issue, than just not wanting to meet new people or not having the motivation to meet new people. That is where the loneliness epidemic, being a social justice and feminist issue, comes into play. According to Barreto and colleagues, there are distal factors of loneliness. These factors may be indirect, but they still impact mental health, such as discriminatory policies, exclusive communities, and interpersonal exclusion. There are also proximal factors of loneliness as well. And these factors have immediate impact on mental health and well-being of a person, such as their physical health, their psychological well-being, financial comfort, and opportunity to socialize. My study looked at these factors and the experiences of women of color in the US who experienced loneliness within the last 12 months. My team and I are still doing analysis on the interview data we have so far, but initial findings reported by participants shared experiences of loneliness stemming from tensions between the misalignment between cultural expectations of gender roles from their racial ethnic communities and participants' desires and pursuits. Participants also share the difference between loneliness and their self-imposed isolation, which was self-protection from things like race-based discrimination, misogyny, and the intersection of the two. And initial findings from some participants found that they desire for society to leave space for people to just be people, creating spaces and or opportunities for healthy coping, authenticity, and healing at societal level. Though my study is still ongoing, we are starting to find that the loneliness epidemic can't be separated from conversations around social context and systemic injustices. Loneliness is a public health issue, but it is also a social justice issue. By listening to these participants, we get an idea of how systems impact loneliness and emotional well being, and how healing is not just an individual issue, but a collective issue. I hope this research sparks more conversation, more compassion, and more action towards mental health advocacy and education on this topic. Thank you.